Good morning, ladies and gentlemen. My name is Frank Zaccari, and I'm the host of a radio show called Life Altering Events. And I am honored here this morning to host a conversation on COVID-19 and the impact it's having on mental health. Now, we're all aware of the physical aspects of this virus, and it is devastating. And that quarantine and separation and isolation will protect our physical health, but what's it doing to our mental health? Reports of anxiety, depression, domestic-related issues are all increasing dramatically as we deal with the uncertainty of this situation. Today, we're bringing in experts in the field of trauma, anxiety, depression, suicide prevention, and where to call for help. Okay, ladies and gentlemen, none of us are in this alone, and the secret to walking on water is to know where the rocks are. Our panel today is going to show you where those rocks are. The panel includes Dr. Annette Zaccari, who has 30 years experience in addressing trauma, brain injury, depression, and anxiety. Jackie Simmons, who is an author, a TEDx speaker, brain retrainer, and is a co-founder of the Teen Suicide Prevention Society, and she's going to explain what all that is about. And then Kellyanne Wilde. Kellyanne Wilde is the Assistant Director for Programs at Arizona Coalition for Military Families, and Kellyanne's program gives you one phone call and connects you to where you need to be. So let's begin. Dr. Zaccari, let me start with you. What are you seeing in your practice as we're going through this continued isolation and quarantine, and how are you advising your people?
First of all, thank you so much for allowing me to share a little bit of my experience that I have seen since the advent of this terrible, terrible crisis that we are all in. COVID-19 has had a host of health crises, global and economic challenges, and societal uncertainty. And it has resulted in the death of many people. And it has also spread such human suffering beyond capacity that has upended everyone's life. We're worried about our own health, we're worried about the health of people we love, and we have concerns about paying our bills, our rent, and returning to normal life. But I wanted to add that COVID-19 is much more than just the healthcare crisis or an economic and social crisis. What I have seen is that it has resulted in a multitude of mental health crises, an increase in domestic violence, and instances of suicidal thoughts, self-harm, and potentially suicidal acts. The focus on shelter at home and social distancing has contributed to profound feelings of isolation and coping strategies that I have seen completely break down when people are in crisis. Isolation can make us feel vulnerable, and in a time of crisis, people need connection with others. They need to have this to survive. Survival can become an act of teamwork, and what this crisis has done is it has diminished and in some cases completely disconnected people from each other. This is especially taxing for people who struggle with mental health disorders. In my practice, I've seen an increase in depression and anxiety with panic, both in adults and with children. Potential symptoms that I have seen are a decrease in emotional management and regulation. Also, avoidance of activities of life, sleep disturbance, fatigue, intolerance and uncertainty within this crisis, excessive worry or fear that leads to panic of life or situations, increased agitation, and a tendency to really become extremely agitated, filled with anger, and a desire to control people or life events. Children also have a tendency to mirror the symptoms of that of their parents. Symptoms that I have seen for children are also resistance to the new order and routine in their lives at home. They feel fatigue, also tiredness, numbing out, displaced frustration, and boredom. And these symptoms can be quite disturbing. And again, coping strategies are also breaking down when people are in crisis or they have an increase in these types of symptoms. So my recommendations to my clients is to focus on not only what they are experiencing, but much more on what they could do about it. So I suggest, number one, limited news intake. I often suggest if they ask, what does that mean? I say, just give yourself 20 minutes, find out what you need to know. And also, I give them recommendations on reliable sources. to get information of how they can continue to manage their stay-at-home orders and social isolation and what they could do, where they can go. I also suggest that they look at potentially online resources like online therapy. I do online therapy now. I use technology to be able to still reach out to my clients and also to work with new referrals coming in to me. I'm so glad we still have technology to be able to offer that support. And I also recommend online support groups, and there are many that I have been referring people to because they still need to have a voice. They still need to feel a part of a community. I find them so helpful for them to be able to voice their fears and their concerns. And this is something that I'm always telling my clients, is there is no shame in asking for help and going beyond what we do in our therapy sessions. I use guided meditation. I offer different yoga apps. I also encourage people to spend time outdoors. But I also encourage when they do that to make sure they look at social distancing and how to manage that. Exercise, all of these techniques are wonderful ways of helping manage the physical symptoms of anxiety and depression. But there's also something else that I often recommend, which I think is most important, is the use of technology. You still can have access to people in your life and the people you love through the use of technology, and including people in your lives to continue that connection. For parents, I recommend that they as parents are role models of calmness and confidence for their children. And because children often set their mood to the household, we want to demonstrate our confidence so that we can instill calmness and resilience in our children. As we continue to structure their day and stay at home, all of us, with our kids, and believe me, I have a teenager and it's not easy, but we do want to maintain that level of confidence so they could be resilient in their lives during this crisis. And the last few points I would like to make is that I have seen a surge in domestic violence for a lot of my clients. Domestic violence that is a direct relation, I believe, to the COVID-19 crisis. This includes women, children, and elder abuse. And I don't want to forget about our seniors. I work with a lot of seniors who have secondary conditions, and they often are vulnerable to these types of abuses at home. This pandemic has closed many of our state offices, and it's very difficult for me to help clients find an order of protection, especially in the situations that they are in, so isolated. They are at home with their abuser, their tormentor. It's very, very difficult for them to access the type of services that they still need to stay safe and to keep their children safe. The added financial stress and these shelter at homes really have made it so difficult for families to really be able to access services to help them through those domestic violence and abusive situations. And here in Arizona, we're seeing a terrible increase in all of this. It's a very, very huge concern here. Social isolation, as I said, gives people a sense of hopelessness and despair. So resources are needed, and they need to be available to help people in these emotional situations. And I often use hotlines for abuse and suicide prevention, which I think we'll be hearing about soon. And I really appreciate the folks here on this panel who are doing such wonderful work in that. All of these, excuse me, hotlines help people have a voice and help them develop a safe plan. I also look for nutritional programs, food banks, utility and assistance. I think one of the things we have to keep in mind, and this is my last point I'd like to make, is allowing my clients to be heard, coupled with helping them find resources and access those resources while we are all in this crisis, helps really bridge the healing, and it also helps them manage emotionally. And with that, I just again like to thank you for allowing me this opportunity.
Dr. Zaccari, we appreciate your input and all of your expertise and all the help that you're providing to a very wide range of clients. Next, I'd like to pivot over to Jackie Simmons. Jackie, here's a question, Jackie. Children and teens have been taken out of their element and their normal routine. As an adult, we should be able to rationalize what we've been going through here. That there's a reason why we're doing this, but children don't understand. And anxiety in their home causes, more importantly, particularly if you're a teen and your whole life is social involvement. Tell us about this nonprofit you're establishing for teen suicides.
Myself, but there we go. Now you
Okay.
can hear me, I hope.
Good.
Okay. The Teen Suicide Prevention Society is an outgrowth of the Make It a Great Day movement. And Frank, this is a near and dear because I found out in August that you can't be successful and keep a secret. And in August, my now 37-year-old daughter stood up to give a public speaking conversation, a 7-minute talk that she was going to have transcribed because she was writing for the Make It a Great Day books and writing one chapter, something inspirational for teens. And she'd gotten writer's block. So she figured she'll give her 7-minute talk and she'll get it transcribed. And it seemed like a great idea. She asked me what to talk about. And I'm like, yeah, well, just tell one of your never quit stories. She laughed and asked me which one. And I said, it doesn't matter. They're all good. You'll rock this. Well, she rocked it all right, Frank. I was super proud of her. I mean, the morning of the event, everything went well. The videographer was set, the PowerPoint worked, and 12 entrepreneurial women, the morning just flowed. Yeah, they were all getting in that nervous, excited state you get into when you know you're going to give a talk. My daughter, I was super proud. She volunteered to go first. And I'm sure it showed in my voice when I introduced her and welcomed her to the front of the room. I was the host of the event, and I had no idea what was coming. I was startled when she shared a statistic, 3,000 a day. That's the number of teens who attempt to take their own lives every day. Pre-COVID, just in the US, and just the ones that don't die. The number goes up if you add the ones who die. I was shocked when her next sentence was when I was 14 and she started talking about her multiple suicide attempts as a teenager, because for 20 years we had had a, let the past be the past kind of unspoken agreement. I think if she had broken the silence on her suicide attempts any other way, I would have found a way to ignore it, because I didn't know it's the conversations we avoid that truly matter. And that's what sparked the movement. By the time she was done, she shared one more thing that caused me to stop breathing. She shared that she still struggled with suicidal thoughts. And my brain just kind of exploded. And how could I have missed this again? By the time everyone gave her a standing ovation and congratulated her on being so brave and took their seats, I had a plan. I'd help her get her program. She wanted to do a program for teens to help them have the coping skills before they need them, the things that she's learned along the way. So I was going to help her. We would take the inspirational book for teens and turn it into a book about how to start a conversation around suicide. So it's a great book of inspirational stories. But the reality was, that whole plan, getting the book done, getting the program started, are all really good things, all needful things to start breaking the silence. But they were another way for me to stay busy and to avoid having the conversation about her ongoing struggle. It's not an easy conversation to have. Now that we have figured out how to have these conversations, we're on a mission to get these skills out into the world. So we've recorded a webinar on the 6 indicators, which Dr. Annette, you went brilliantly through the lot of the indicators that we see that make you aware that someone in your family might be at risk. So it's mindsetseminars.com is where the recorded webinar is. It's the 6 indicators and the 6 steps to take, how to actually start and maintain a conversation on this topic. This is the critical conversation. It used to be the conversation we needed to have with our teens was about sex. And then the conversation we needed to have with our teens was about drugs and alcohol. Now we're finding the conversation we must have with our teens is about suicide. It's not complicated. There are 6 very simple steps that will open it up in a neutral way so that you're not asking them, have you thought of committing suicide? Because they're going to tell you no. And we don't commit suicide anyway. It's no longer considered a crime. And you're not asking them, have you thought about taking your own life? Yeah, harming yourself. Any of those questions is going to get you the typical teenage response of, go away, I'm fine. Oh, by the way, fine. This is code. Fine. Frenzied, insecure, neurotic, and emotional. That's what it means when a teen tells you they're fine. So I absolutely agree with what Dr. Annette said. One, you need to be able to have these conversations in your own home, and you need a support system outside the home. So there's an 800 national number. It's 1-800-273-8255, and you can text to that number and get help, which is how teens like to receive help. And we know it works best if they're talking to someone they don't know, someone who doesn't know the possible players in their pain. The anonymity is critical. The other place for being anonymous is with assessments and online support groups. And there's a whole collection of them, as Dr. Annette says. My personal favorites they can be found online at emotionalelephants.com. Mm-hmm. And this guarantees their anonymity and gives them access to mental health professional facilitated support groups. And so all of this is free. No one needs to go through this alone. So we're here to help. We can be found at the Teen Suicide Prevention Society, but it's easier to just catch up with us through the seminar so you actually get the 6 steps for the conversation. And thank you, Frank, for inviting me.
My pleasure. That is such an amazing story. And as parents, we often miss a lot of the signs with our children, and we're with them all the time as they're growing up, and we still miss. We just don't see it, or we're not looking.
Most people are unaware of the most startling thing that we're seeing, which is the fact that often the first symptom that someone is in trouble is an attempt to take their own life. It's not what people think it is. If you're waiting for an obvious sign before you start the conversation, you're putting yourself at risk of dealing with what I had to live through. I don't recommend it. Start the conversation before you think it's needed.
Absolutely. Absolutely. Get ahead of the curve.
Mm-hmm.
Well, Jackie, thank you so much for your input here. Next, ladies and gentlemen, we have Kelly Ann Wilde. Now, Kelly Ann, we've heard information from Dr. Zaccari and from Jackie, but where do you go? What do you call? Is there one phone number you can call and not be given War and Peace to go look at, or a series of websites? Or in my case, as a veteran, when I went to the VA for the first time, they gave me a book that was the Signs of War and Peace, of where I could figure things out. Well, you can't figure it out. So Kelly Ann has put together a program with the Arizona Coalition for Military Families, and the program is called Be Connected. And this is a godsend in Arizona, and if in other states, if you need help, get a hold of Kelly Ann. Kelly Ann, tell us about the program.
Thank you. Good morning. I'm so happy to be here and happy to be on the same panel with Dr. Zaccari and Jackie. Also, it was great to hear from them, and thanks again, Frank, for having me on this morning. Really what our program is it's for service members, veterans, and their family members. And I want to be real clear, when we say family members, we mean any family member. That can be a sibling, that can be a grandparent, it can be a spouse. I can't tell you how frequently I'll tell people, oh, are you a service member, veteran, or family member? And they'll say, oh, no, my sister served. And I say, you are a family member. And I think one of the most important things for our program is, so I work for the Arizona Coalition for Military Families. The reason Be Connected is a national best practice model for what we're doing here in Arizona is because we realize that one organization can't do it all. Frank, as you mentioned, if you are looking for resources, you'll find a book as big as War and Peace. The good part about that is that there's so many resources available. The difficulty is, how do you find those, and how do you find the ones that you qualify for? Now, what we've done with the Be Connected program is used a plethora of organizations throughout the entire state to come together in one centralized location. So when I say the Be Connected program, it's all 3 state VAs, Northern, Central, and Southern. It's the Arizona Department of Veteran Services. It's Tri-West. It's Access. We work with Crisis Response Network and Community Bridges. And then it's the Arizona Coalition for Military Families. And it's our hundreds of Be Connected partners that we have throughout the state. So what we do is make it easy to find the resources that you need. We make it easy to reach out, because what often happens is, one, just even as Dr. Zaccari and Jackie both mentioned, it's difficult to have the conversation. One, it's difficult to ask for help. And 2, it's difficult to ask somebody if they need help. So really what we do is make it very easy to kind of be able to open up that conversation, find those resources. Because what we heard in the past, especially with service members, veterans, and their families, is why did I have to get to a point of crisis to find out that I had all these resources available to me? So what we do is have our information and support lines, so it takes that stigma away of, oh, you have to be in crisis to be able to find these resources or to ask for help. And so you can truly just call for information and support. So that number is 1-866-429-8387. It's operated from 8 a.m. to 5 p.m. from our Be Connected support line staff, who are wonderful to talk with. The moment somebody comes through that line, they typically ask for the same person. They'll say, oh, I want this person. They're all veterans, service members, or family members themselves. So they've been through it or have had family members that have looked for information and support previously. But really what happens when you call into that line is the support line specialists are able to talk to you, see what your situation is, and then connect you to various resources. So for us too, one of the most important things is taking a holistic approach. So if you call in for one thing, we're not just going to say, here's this one resource. We're going to give you several different resources that you qualify for and that you're looking for. So if somebody calls in and they say, hey, I'm looking for a job, and we're getting that call quite frequently with COVID-19. I will say the good news is that there are employers that are hiring right now. We have our Arizona Veteran Supportive Employers that are currently hiring. So if you know anybody who is a service member, veteran, or family member that's looking for a job, please call this line, because that is certainly something that we can help with. But with that holistic approach, we're really trying to see what are all the different things that are affecting this person and their family's life, and then get them to those various resources that can help. And what's really important to know too is it can just be in this time. We've had people that say, you know, I want to be involved in the community. And I know in isolation that can feel very difficult to feel like you're part of a community, but there are areas that are taking volunteers. There are still webinar events that you can attend, so you feel like you're still part of that community. We're holding some of those webinars. Several of our Be Connected partners are holding those webinars as well. So you can call in and even get connected to volunteer opportunities, events. You can call in if you're saying, hey, this is a perfect time for me to figure out, I want to go back to school. Maybe I could do that online. What are my benefits? Can I utilize the GI Bill? You can call for that. So really what we've done is make it easy to find all of those resources that are available. And we've been able to do that by having all of these organizations communicate together. So one thing that I really want to say is when you call that line and our support line specialists connect you with an organization, it's not an organization that we don't know. It's one that we've gone through and vetted so that you know you're going to be utilizing a reputable organization and you're going to get the best services that you can. The best thing to know too is that you're not in this alone. You have a whole team of support. The other aspect that's really interesting about our program is you can call the support line. If the support line staff member realizes, okay, this sounds like something where we actually need to send somebody out to be able to kind of give that hand-to-hand, face-to-face connection with somebody, we have 10 navigators all throughout the state. So those are full-time navigators. Right now it's a little bit different. They have to go through a screening test before we can send out a Be Connected navigator, just for the safety of our team and for those that are calling the line and utilizing the program. But one of the really big things that we're seeing right now that people are calling for is food boxes. You'll see with our older veterans, they can't leave, they can't drive, but they need food, they need supplies. Our team is actually able to go out and provide that food with them, wearing a mask, gloves. We take the proper precautions in doing that. But it really, truly, I can tell you if there's something where you're wondering, oh, can I call the line for this? The answer is yes. The other thing that I can say too is, If you're not a service member, veteran, or family member, but you know someone that needs help, you're also able to call on their behalf for you to be able to find out how you can help. I think that's really important too at this time, or maybe if you have a neighbor that you're concerned about, or a family member or friend, you can certainly call on their behalf too. What I really truly will say is what we're going through with COVID-19 is really difficult, but I can tell you on our end with the Be Connected program, it's been unbelievable seeing the way the community and the entire state of Arizona has been coming together to be able to help our military veteran population. And it's just been really encouraging to be able to see people call in and really say, you know, I don't think anybody can help me at this point. These are the various things that are going on. And by the end of the day, they call us and they say, wow, thank you for being able to give me the help that I didn't think that I would ever get. So I really encourage people, the phone line again is 1-866-429-8387. And then our website is beconnectedaz.org. And really on that website, what you can do too, if you're not comfortable calling a phone line and you have the ability to get onto the website, you can search all of our resources throughout that website as well too. So the good part is that if you're more comfortable talking on the phone with somebody, pick up the phone and call. If you want to just search online, you can do that too. We've really tried to make it so that whatever somebody's comfortable with, we're able to help them in that way.
Kellyanne, thank you very much for that. I have been through the class and the training that Kellyanne holds, and in the state of Arizona, this is as good as it gets. In other states, if you want this kind of a program, contact Kellyanne. I'm sure they'll be willing to help you. Well, ladies and gentlemen, our goal today was to give you hope. You don't have to wait until be in crisis. There are resources here who can help you address the day-to-day stress associated with this virus. We're going to get through this. We're going to come out the other side better. But remember this, ladies and gentlemen, during hard times, please do three things. Look up, get up, and never, ever give up. Better times and better people are going to enter your life, just like the three experts we had here, Dr. Zaccari, Jackie Simmons, and Kellyanne Wilde. Thank you, ladies. This was wonderful, and we'll get this up online very shortly.